Hello, thank you for joining us for the RUHS webinar series today. I'm Dr. Chad Versio, the Chair of Pediatrics at RUHS, and we are going to have three individuals who have been critical as we approach flu season this year today as our guests. This season, as you may have heard, is by some being referred to as a twindemic, or the potential of a twindemic, where we have both COVID hospitalizations and flu hospitalizations potentially overwhelming our healthcare system. And so we want to do whatever we can to decrease that possibility. And one of the things that's going to be very important about that is the flu shot. And so today we've invited three individuals who are impacting our approach to flu vaccine this year. Dr. Bruce Wang, who's one of our infectious disease specialists, Dr. Shenling Tsang, who, if you know Dr. Ron Johnson, his reference to her is that she knows everything and she can do everything. And I've generally found that to be true. And then we have our wizard of IT, Dr. Vikram Kumar, who has done a lot of work in putting together dashboards. I'm sure some of you have seen the COVID dashboards that he has put together, and he has been working on a flu dashboard that he's going to introduce to us today. So thank you again for joining us. We'll get right into this, and we're going to start with Dr. Bruce Wang, who's going to speak to the importance of flu vaccine, especially this year. So Dr. Wang, why don't you go ahead and share your screen, and you can go through your presentation, and I'll ask some questions as well.
Thanks, Dr. Versio. Hopefully everybody can see me. Well, not see me. I don't have a camera, but see the PowerPoint slide and can hear me. So there's a lot of people wanting to talk about different topics in regards to flu, so I'll be a little bit brief. This is just going to be a little bit of an update and overview, some thoughts to maybe tickle your brain a little bit and give you best case scenario versus potentially worst case scenarios, but we'll see. But just some brief updates. You know, at least for this year, we have two new vaccines, and I'm sure a lot of you have read about it, the high-dose quadrivalent and the quadrivalent adjuvant vaccine, specifically for the 65-year-old and population. So just so you're aware, and then also the trivalent vaccine that the company make is eventually going to be phased out. But just so people are aware of that option out there. On an announcement by RUHS, I believe back in mid to late September, there was significant reassurance that we would not have expected lack of influenza vaccine, which Dr. Kaiser had also mentioned as well at the time. So, you know, if there's any concerns in regards to supplies for flu vaccines, we have more than enough. So all the more reason to make sure people get their shot or even intranasal spray. Some controversies and just, again, more food for thought than anything. And like Dr. Versio had talked about at the very beginning, was the concern about having a twindemic or having to deal with both COVID, which we know continues to rise up throughout the country and the world. We're seeing outbreaks and further increases across the U.S. Europe, for example, they're having, you know, subsequent waves and stuff like that. We don't want to have to deal with this and influenza, not only in the community, but in the hospital system as well, to just completely overwhelm all the resources. Interestingly, when they were looking at the studies, and this was put out by MMWR at the mid-late September, when they were looking at flu, because there's always flu somewhere and it's always flu season somewhere in the world, in the southern hemisphere during their flu season, they specifically were looking at Australia, Chile, South Africa, and then also looking at the U.S. Toward the end of flu season earlier this year when COVID started to really creep into our population. And looking at this, they actually saw that the southern hemisphere actually had little influenza activity, probably from all the social isolation precautions and masking restrictions and recommendations that had gone into effect at that time. If you look at where the arrow is here at the top, where the U.S. declared national COVID emergency, you kind of see the significant sharp drop in influenza cases during that time period. From about mid-May to the beginning of August, there was about a 0.2 positivity test during that time period versus about a 1 or 2% during non-flu season in the U.S. if you go back the previous 3 years. And then the positivity rate for flu dropped off really sharply to almost zero by early April. But at that point, we were kind of in full swing with, so to speak, masking, closing of non-essential businesses, and trying to institute social distancing policies. Typically, it would still hover around 15% overall. So these are just kind of the numbers. This was actually the information from the Southern Hemisphere, Australia, Chile, and South Africa. The top, you see kind of previous seasons pre-COVID. I'm sorry, I have it reversed. That's during COVID. The bottom is pre-COVID. And they had about 51, although they, I think, upped it to around 55 samples after their study came out, among almost 100,000 or 83,000 tests that were done. Keeping in mind, maybe there are people that aren't getting tested, of course. And then looking back, the previous 3 years, almost 200,000 tests, and they were having almost 25,000 positive influenza tests at that time. So, we know for a fact that obviously mask and hand hygiene makes a huge difference. We see it in our healthcare facilities, or if you're working in offices, if people don't want to get their shots for flu, we often will recommend that they mask during the season to try to prevent transmission to other people and healthcare providers along with patients. So what does this really mean, though, for the U.S. right now? We're just hitting our flu season. I sat down with infection prevention, and in our hospital right now, we've only had about 8 influenza positive cases so far on both the adult and pediatric side, and that's been consistent with previous years. So we're really just at the beginning at this point. In a perfect, ideal place, I'd like to see what we saw in the Southern Hemisphere and see a significant drop-off in influenza. But that, of course, also keeps in mind that people are also getting their influenza shots. They're continuing to mask, which we see is a big issue over here in the U.S. Hand hygiene, and then obviously large indoor gatherings, which continues to be a significant challenge, of course, in the U.S. here as well. But now we're seeing that across into other parts of other countries. The proposed thought was, again, if we are able to kind of maintain the rigid restrictions with COVID-19, and again, this is obviously very challenging for families, friends, work, businesses, and we understand that this potentially may decrease the incidence and the prevalence of influenza throughout our community, just not here in Riverside County, but throughout California and then the rest of the U.S. And that really is what we would like to hope for the most at this point. One other thought, too, is the timing of the influenza vaccine. I don't know if Dr. Sang will also go over this a little bit later, but just briefly, from the CDC, they're recommending to defer influenza vaccine, and primarily this is the approach more in the clinic and community setting until patients have met the criteria essentially for de-isolation if they were COVID positive. So again, you can see 10 up to 20 days, depending on if they fall into the mild to moderate versus severe critical symptom with criteria for COVID. You have to have, resolution of fevers, symptom improvement as well. And this statement was more to just try to avoid excessive exposure of patients coming into the clinic and exposing other patients, staff, physicians, nursing, all other healthcare providers. If they're isolating at home and not interacting with other people, their risk for catching influenza during that isolation period is probably pretty low, unless another family member catches it and gives it to them. Having COVID in itself is not a contraindication, especially with mild disease. The literature on, severe and critical, it's a little bit less clear. Typically, we'd probably wait till there's some improvement and at least make sure they get their flu shot prior to discharge. But at least in the outpatient and clinical setting, recommendations is at least to wait till they're able to come out of isolation in those settings. So in summary, we're not expecting any influenza vaccine supply issues or lack of antiviral therapies, such as oseltamivir if needed. Influenza is here already. It's here to stay. It's not going to go away. We've already seen this in the hospital. So far, at least we're at the typical rates that we're seeing, but the expectation potentially is it may go up. To mitigate the spread of influenza, It's essentially follow what you're doing for COVID out there. You know, wash your hands, continue to mask, continue to make and adhere to social isolation, social distancing, and low risk large gatherings. And then most importantly is get yourself vaccinated, get your patients vaccinated, get your friends and family vaccinated. Like Dr. Kaiser had said previously in previous years, even if at worst the flu vaccine was 5–10% effective, well, that's 5–10% less people that are going to get influenza and potential complications from it. So these are just kind of the stuff I brought up about unanswered and uncleared questions going forward. We're going to just have to see what happens at this point. And that's pretty much it for me. Try to keep it short and sweet and to then move on to Dr. Singh here.
Thank you, Dr. Wang. A couple things that I noticed through there, you know, it does seem like we could be somewhat hopeful about this as long as our community does continue with masking, physical distancing, avoiding large groups that would contribute to significant spread. And so it's really kind of up to us, I think, is the message. You know, it's really how well do we moderate our behaviors to decrease the likelihood of spreading COVID or flu. And it is interesting that, you know, back when we really went into strict lockdown in March, we saw flu disappear within 5 days in pediatrics. No, you know, essentially no flu cases after the first 5 days of lockdown or so, I would say. And generally we have some admissions, you know, for flu or RSV and after March through April and sometimes early May, and we didn't have any. Basically. And so we definitely noticed the effects of schools closing, of people physically distancing. And I'm not saying that that's, you know, necessarily a justification to keep schools closed or anything like that, but those things do decrease the spread of these infectious illnesses. So, all right, we'll turn it over to Dr. Singh now, who's going to share with us what RUHS is doing to improve our flu vaccination rates. There's some exciting things happening. So we wanted to make sure you're aware of it, and then also that other partners across the county are aware of that as well.
So good afternoon, everyone. I'm going to share my slides. Let me make sure they make it onto the screen here. Okay, so RUHS has a lot of activity around the flu vaccination, flu campaign, both for patients and employees, and it takes a team to get this process going, and we're very excited to have a unified flu approach, you know, going forward in order to prevent, as Dr. Versio said, this twindemic to reduce the risk to our community. So just to give you an idea of what's happening around Riverside County, Riverside Public Health recently did a flu drive-through campaign. And it was at 3 sites that we're also doing our COVID testing at, not at the same time as referring to Dr. Wang's talk about, you know, COVID and flu together. We're trying to avoid, you know, maybe some complication there, but we did do a flu drive-through at the sites where we normally test for COVID on the days that they were closed for COVID testing. The exciting thing is we were able to give 750 flu shots for free to the community members through a drive-through campaign. So I wanted to share that with you. That was something very exciting and the first time public health has tried to do that. There's also a lot of retail pharmacy flu efforts. You know, we were actually first told about this from a patient who said, oh, I'm going to get my flu shot at Target because I get a $5 gift card. I said, oh, that's interesting. And so, you know, we looked at, I then kind of did a search to see what are retail pharmacies doing. And you can see here, a lot of people are giving incentives to get the flu shot this year. So, you know, with insurance, with most insurance, there's no cost. And in fact, you know, you can see up here with CVS, they're offering a $5 gift card. Walgreens is also giving a $5 off any $20 purchase. You know, Target is also giving a $5 coupon with your free flu shot. And so, you know, there's a lot of push, I think, to get our community in general vaccinated. So you might hear some of your patients saying that as well. The good thing with these vaccinations done at our retail pharmacy is that it connects to care, which is bi-directional with Epic. So if they get them done at an outside pharmacy, we will still get that immunization record. Okay, so the next thing is looking at our health plans. So, the health plan is also supporting the flu vaccination effort. So this is from IHP, and they're offering a $25 incentive for patients in Dr. Versio's age range of 13 to 24 months. So our pediatric patients, they get $25 if they get their flu shot as an incentive to try to bring more patients in. And as well as in the 0 to 12-month range, and really it's really 6 to 12 months, right? Because the minimum age for flu shot is 6 months. They get $50 if they get their rotavirus and their flu vaccination. And so they're trying to also bring in patients to get their vaccinations during this COVID season. So on the inpatient side, we have had standing flu vaccine orders, and that continues to be the case. And we're trying to make sure everyone who is on the inpatient services, if they can get vaccinated, that is very important as a protective measure for that patient and for the community. And then we have an employee flu campaign as well, and this is being led by Davlin Tidwell, our director of pharmacy, as well as many collaborators. And so, our goal is to make sure everyone gets their flu shots from the care team side. And I'm excited to share with you that Banning Community Health Center, 100% of their employees received the flu vaccine for this season. So, we were very excited to see that as we encourage, flu vaccination rates amongst all of our employees as well. So in thinking about this flu season, we put together an ambulatory flu task force to really unify a lot of the work that's being done across our system. And, there's a lot of activity, and, we usually meet once a week at this point, and it's really to look at how can we spread best practices? How can we improve our overall visibility for the patients to get that flu vaccination? So at the MSC, there is a vaccination station being planned on the first floor to capture the public foot traffic that's coming through for all the wonderful services we offer there now between radiology, physical therapy, pharmacy, and then as they then go up to the different floors, we want to try to capture those patients and their family members or loved ones and get them vaccinated. There's a lot of marketing going on right now with Christine Ramsey and Heather and their teams. There's posters, we have flags coming, exam room flyers, there's social media events. We're working on a My Chart Flu campaign blast, directing our patients who are on My Chart to check out the ruhealth.org flu site for more information, as well as where they can get flu vaccinations, as well as messaging the importance of flu vaccine during the season. We're working on a hold line message to, where it gives information about the flu, looking at our waiting rooms, looking at all of our community health centers. Right now, we are accepting walk-ins for anyone who wants to come in from the public to get their flu shot. They walk in, we register them, we give them their flu shot, and they can go on their way. And so we really are pushing that in the community as well. We have flu champions at our clinics. We're looking at vaccination stations in all of our waiting areas. This came from pediatrics as well. We're looking at scripting for our staff to look at presumptive vaccination messaging with our patients to help kind of push that message again and get our rates up. We're looking at virtual visit strategies. As you know, COVID is still here, so we do still do a lot of virtual visits, but making sure we get them in with a nurse visit or some kind of visit afterwards. We're looking at Mythbusters, flu vaccination tracking, and then of course, the wonderful website at ruhealth.org/flu that our marketing team has put together. So just to give you an idea of what some of the the marketing campaign looks like, this is one of the posters. I apologize for the angle. I took a picture of this on the fly, but I thought this was great. Roll up your sleeve and fight flu. So talking about some of our goals, and so our task force has set forth some goals for both primary care and specialty care. And in primary care and specialty care, we've set a goal of offering at least 95% of our patients the vaccination. And then we're hoping to achieve 80% given rate at our primary care clinics. And then in our specialty clinics, we're hoping to reach the 75% rate. And Dr. Kumar, after me, will be speaking to some of the dashboards we're using to track our progress. So to give you an idea of where we've been able to achieve to date, so at RUHS, we've been able to vaccinate or confirm vaccination from the season in the primary care setting. 6,808 patients have already received their flu vaccine. And then in the specialty care setting, 1,272 patients have already received their flu shot this season. So that was exciting to see. We wanted to share those numbers with you. Lastly, I can't take credit for this at all, but I did want to show it because it's such a great website, and I'm hoping more of our patients use this. This is our new flu website within our RU Health web portal. And so this is something patients can go to get up-to-date information about their flu, where they can go to get their flu shot. You know, they can just enter their information here, and then it'll direct them to our nearest clinic where they can get a flu shot for free. There's a Q&A section and other resources. And so I thought this was a great addition to our website. So with that, that's the end of my presentation.
I apologize. Zoom failure. Thank you, Dr. Sang. You know, what has been your, you know, the approach that you have thought of in developing a team that is working on improving flu vaccinations?
Right. And I believe, you know, in the past and even earlier this season, a lot of us have an interest in increasing flu vaccination rates, and especially with COVID. And it really was gathering all those great minds and passion together in one place so that we can work in one direction and really focus our efforts on what we can achieve during this flu season. And I think this, you know, this year we've really had this great opportunity to bring ourselves together, and we've brought marketing to, you know, this group is a multidisciplinary group. There's nursing, marketing, operations, frontline providers, you know, really looking at it from a multidisciplinary approach on how we can increase and impact our patients in a positive way this flu season.
Yeah, it's been really impressive to see that team come together. Thank you for your leadership in that. All right, so we'll transition now to Dr. Kumar, who's going to speak to us about the development of the flu dashboard and kind of go over that with us. We are hoping to have him scheduled for a subsequent webinar to speak to dashboards in general and how he develops these, what kinds of things he views them to be useful for in the future. But he'll speak with us specifically on the flu dashboard today and how we can use that to drive improvement.
Thank you, Dr. Versio. Good afternoon, everyone. If I could share my screen. So we had reports in relation to the flu vaccine by clinic, and we thought it may be helpful to pull it into a consolidated dashboard. And we use Microsoft Power BI, and we get an extract from our EPIC, which is our electronic health record system. And the intent of the dashboard was to look at the performance overall as a healthcare system, and then give that information to our frontline as well as our physician and operational leadership, so that they can have a snapshot of where our performance is with flu vaccination compliance. And we started looking into data from the 1st of September. So there are 2 pages right now to the dashboard, and I'm sure we'll be adding more to it in the coming weeks and months. The first page, which you're viewing right now, looks into the overall information. So you can see, and this data is dated by a week, so that's why the numbers are lower than what Dr. Sang presented earlier. You can see our overall compliance at the clinic level, and then there is the breakdown by different clinics. We also track the reasons for when the vaccine is not offered, or when the patient declines, or if there are allergies that prevent the vaccination compliance. And then what the clinics and their clinic managers and the physicians in charge can also do is, I'm just going to pick on Harupa Clinic here. They'll be able to drill down by individual clinic, and then look at their compliance rate at the clinic level. And then you can also see the compliance rate overall. The numbers also would shift based on the clinic. So that would also encourage some positive competition, some healthy competition amongst the clinics. But it also gives, if it's a certain clinical area that needs more drill down, it allows them to get into that information. And we can also filter this by service. Family medicine tends to be our most, given that they provide most of the primary care. But it can be filtered down by the type of service as well, primary care or specialty. The second page of the dashboard gets into some granular information by week. And this information is dated by a week. So this is on the left side, you'll see the weekly information for week 43, which was last week. And you can see the total number of encounters. And then we are actually closer to about 50% with our vaccination completion. So you can see that granular information by a specific week. And then we also track the flu-like illnesses by week and for a specific week. And we try to trend it as well. So the flu-like illnesses, as some of you may know, is a very specific finite ICD diagnosis set of codes. And it can vary from common cold-like symptoms to an ear infection. So it's not very specific, but it would be more on the sensitive side for flu. And it also tends to overlap quite a bit with COVID-like illness when you look at the diagnosis codes. So, and we are able to drill down by individual clinic as well. And then on the right side, you can see this goes by week. So we started looking at this data from week 36, and now we are actually in week 44, but this data is about a week old. And you can look at vaccination completed rate, and you can see that there's been an uptick. And then the plateauing is more a function of catching up with historical information, but you will start to see an uptick as the weeks progress. And then we also track our flu-like illness by clinic. And then you can see that by week, and you can see that the flu-like illness by week shows a slight upward trend, the dotted black line with each passing week. And we are again in week 44. And then the orange shaded area and the orange line is actually some predictive analytics that uses machine learning and artificial intelligence that predicts based on the data we already have. And you can see there's a wide range right now in where we can see the lower and upper ranges of what our forecasts will be for the coming weeks. And that information too will get tighter as we have more weeks of information. So that gives us some insight into the trending and also some prediction. And then on the right side, the light blue line that you see is actually flu-like illness for all of Riverside County. And this actually pulls from publicly available data sets that includes people posting on Facebook, people searching for flu-like symptoms in Google, and then also publicly available data sets on clinic visits and ED visits within the county. And you can see that trend line too is slightly at an angle, and it is slightly increasing. And then you can also see some prediction for the coming weeks based off of that. And then so thus far, I think going back to last week, I think we've had about 1,400 flu-like illness visits. And we are trying to see if there's a way to separate, the flu-like illnesses from actual COVID or COVID-like visits, but that's hard to do, both from a symptom standpoint, but especially from a data standpoint. And then the lower visual right at the bottom of the screen is the flu-like illness encounters by different age groups and the variation from week to week. Some of the other things we intend to add is, and actually this page, the prototype was actually developed by Dr. Sang and her group, so many thanks to her. And then moving forward, we also want to look at upcoming encounters and try to see if we can get a snapshot of the upcoming encounters for the next 4 to 6 weeks to see which of those patients have not had a flu vaccine, and if we can start focusing on getting those patients in. We're trying to see if we can use data to convert some of our telehealth appointments to either be a partial telehealth plus a flu visit type of appointment, or trying to convert some of those telehealth appointments to face-to-face appointments so that those patients can come in and get their flu shots in time. And then we'll also be looking at the offered versus given split with the flu vaccination, and I think that'll give us more granularity. Thank you, Dr. Vasia.
Thank you so much, Dr. Kumar. This is an amazing amount of work, and I think will really drive improvement. You know, Dr. Sang and I have been working on other projects to improve metrics that relate to patient care. And one of the big challenges has been performance dashboards that can drive behavior. So as you mentioned, you know, people can get a little bit competitive, and that's sometimes healthy in driving improvements. And that actually makes me recall, I have a good friend who did a fellowship in cardiology and a subspecialty in cardiac ICU. And he's done a couple of research projects where they looked at just putting what the average, say, extubation time after cardiac surgery was, and that changed people's behavior. People wanted to be average. They didn't want to be over average. And so just having something to shoot for can be very, very helpful. So I think this dashboard is really going to drive our improvement in our clinics. Any questions from those on the webinar today? We'd love to hear your questions. You're welcome to put those into the chat so that we can address those. And I'll let our guests ask any questions that they may have for each other as well. So Dr. Wang and Dr. Sang, I don't know if you have any questions for each other or for Dr. Kumar.
I don't have anything right now. I think I would just give my hats off both to Dr. Sang and Dr. Kumar. Dr. Kumar obviously has been a big part not only of creating this influenza dashboard, but all the IT informatics that's been done at RUHS, you know, our COVID dashboard, obviously, and then Dr. Sang, just all the hard work she's done, not only on the inpatient side, but in the community, that just keep driving these plans and interventions forward. And I think it's only going to be for the betterment of our community, really, at this point.
Right. Yeah. Yeah, I agree. Both of them have been powerhouses in their respective areas. It's been amazing to see what Dr. Kumar has been able to pull together from so many different sources and give us meaningful information that helps us know where things are headed, especially with COVID, and also with the flu dashboard, having some idea where the flu-like illnesses are headed, so that we can understand that and prepare for it as we need to. So, all right, I think that will close today's webinar. Thank you so much for joining. Thank you to Dr. Kumar, Dr. Sang, and Dr. Wang for their expertise and sharing that with us today. I hope you all have a wonderful day.